Well, greetings. I have an interesting job today. So I'm going to talk about stem cell therapy and biotourism. But what I want to do is I want to kind of frame this, coming between Dr. Lloyd, who you heard started really thinking about the genetics of pulmonary fibrosis about 15 or 20 years ago. And you've heard how much progress has taken place over that 15 or 20 year period. What I'm going to talk, and he talked about what is known, and I'm going to talk about what is not known. And then when Dr. Glassberg speaks after me, she's going to talk about how we're going to figure it out. So you can consider me to be the in-between part of that conversation. I'm assuming I can figure out how to get the slides to advance. Here we go. All right. So what I'm going to try to do in the next couple of minutes is talk about a couple of things. What is stem cell therapy? I want to talk importantly about when stem cell therapy is actually approved. We'll get there eventually. I want to talk a little bit about, thank you. Perfect, thank you. Okay, so these are my disclosures. None of them are really relevant to what we're talking about today. Okay, so what is stem cell therapy? When is it approved? And I want to talk about what biotourism is, because this is something that might not be a concept you've heard a lot about. I want to kind of discuss this. And then I want to end up by talking about, is it time for stem cell therapy and IPF? And that's going to transition into Dr. Glassberg's talk. So I think that throughout this meeting, you've heard that IPF is a disease of aging. And we know that the vast majority of patients who we see have reached their 50s, 60s, 70s. Part of the way we know this is by work by people like Ganesh Raghu, who looked through medical claims data. And what he found is that if you look in patients who are 75 years and older on the far right of the slide, you see much higher frequency of idiopathic pulmonary fibrosis than if you look in people who are 65 to 74, 55 to 64. So we know that this is a disease which for some reason occurs more the older that you get. So there's been a lot of discussion about why that is, and you heard some of the ideas from a kind of biological mechanism actually in Dr. Lloyd's talk regarding telomerase. But I'd like to frame it in a slightly different way, and that is that we live in a dirty world, and I could not believe it, but this is actually Nashville. And this is Nashville in the smog. You couldn't tell it from how beautiful it is today, but apparently sometimes it looks like this. So we all live in a world where we encounter a variety of different environmental features, and we bring to that world our own unique genetic characteristics. And those are things we really can't change. That's what we got born with. So when we encounter these environmental stressors, lung injury happens. And I often liken this to your skin, because your lung, even though it's inside of you, it's constantly in contact with the outside world because you're breathing in the outside world. So you can remember that when you were a child, or maybe you have children or grandchildren of your own, when your grandchild or your little person falls down and gets a scrape, that scrape seems to disappear. And then as we get older, our ability to repair and to heal becomes less and less perfect. And when that happens, what we can see is the scars that we develop on our skin. So the lung is no different from the skin, except it gets hidden inside of you. So we're exposed to things like smoking. You heard about dust exposure. You heard about occupational exposure. Some of the work that we do may put us at increased risk of having these lung injuries. We all walk around in a world that's filled with viruses and bacteria, and even the most careful and cleanly people pick up these viruses from their environment, and these too cause lung injury. You heard a lot from Dr. Lloyd about the genetics. That's truly something that we have no control over. We all hope we've chosen our parents well, but they give us what they will. And so we live with the choices that our parents have given us, our genetics. And because of those things, lung injury that occurs also has to be repaired. So much in the same way that the skin that has been damaged needs to be healed, the lung injury that's damaged needs to be healed. And that's a very complicated process. And I want to kind of give you this background because now I want to take you into what stem cells are and why they might be relevant in a disease that's involved with lung injury and repair. Okay, so wound healing, the changes that we see if we cut ourselves and our skin grows back, has to do with the ability of cells to divide and replace a place where they've been damaged. And it turns out that one of the very common processes by which this happens is something called stem cells. So stem cells are cells that can both make more of themselves, but importantly, what they can do is they can actually turn into other kinds of cells. So these are what we might think of as being precursor cells. So we know that these kind of cells exist because we start off as being an egg and a sperm, and then we turn into a human being with all these different cell types. And so we know that we've known for a long time that these stem cells exist with this capacity to differentiate into other kinds of cells. So what does that mean in terms of stem cell therapy? Well, the idea of stem cell therapy is that you find a source of stem cells, and I'm going to talk about what some of those sources are in just a minute. And then you can either treat cells to create stem cells that you want, or you can grow them in a culture dish, or you can just sort them out from other kinds of cells and clean them, and then eventually they go back into a person, a patient. Now, what I'm going to mostly focus on are things where we're talking about the word we use is autologous, things that come from ourselves, but they're also allogeneic, things that come from somebody else, get treated, and then get given back to us. And so once these cells have been put back into the person who is ill, those stem cells are able to differentiate, to go from being these very primitive cells to being more specific kind of cells. Maybe they're becoming skin cells, maybe they're becoming blood cells, maybe they're becoming lung cells. But that's conceptually what stem cell therapy is all about. So where do stem cells come from? So many of you will remember that probably 15, 20 years ago, there was an enormous amount of discussion and agitation because one of the first places that stem cells were harvested from was embryos. So human embryos that had either been created through in vitro fertilization or other approaches like that. And we knew that those stem cells were very early in their development because they were going to go on and develop into a human being. And in a laboratory, they could be differentiated or created into or pushed into different cell lines. But what's happened over the last 20 years is that we've realized you don't have to use an embryonic stem cell. There are actually a lot of other sources that are firstly a lot easier to get to, a lot cheaper, and have a lot less implications socially. So now we talk about adult stem cells. So what that means is that even though you're now an adult, there are still places in your body where there are these very primitive cells that are there to essentially fill up if there's some set of cells that gets damaged. You know, thank God we have these, otherwise we'd run out of skin after we have a sunburn. I mean, we need these cells to essentially replace all of the cells that die off normally, and sometimes abnormally when we get a disease. So adult stem cells have been an incredibly important part of the move forward in stem cell therapy. Now, the last place you can get stem cells is what's called induced pluripotent stem cells. So embryonic stem cells can do all sorts of things. They're very expensive, they're hard to get to, they have a lot of issues. Adult stem cells, there are not that many of them, and they're still a little bit hard to isolate, and it's hard to get enough of them. So now we've moved into this idea of induced pluripotent stem cells. So what that is literally somebody can take a piece of your skin, they can put it in a dish with the appropriate kinds of chemical stimulants, and they can turn it back into one of these primitive cells. So what that means is that at some point in time, and I'm saying this because I really do believe it will happen eventually, they'll be able to create a lot of different types of cell types, blood vessels, organs, God knows what, that are specific to an individual. So you can see that this is an area that's got a tremendous amount of potential to it, and that over even a fairly short period of time, there's been a huge amount of progress in terms of how to make these cells. Now, I also want to say, though, that most of the studies that are done, most of the use of stem cells, and I'm going to talk about what we use them for, have really only happened in the last couple of years. And a lot of this is still at a research stage, and so that's what Dr. Glassberg is going to talk about. So, is stem cell therapy approved by our Food and Drug Administration? Well, yes, it is, but only in a very, very few situations. Some of you may know people who have been unfortunately affected with leukemias or lymphomas. These are blood cancers for which they sometimes go through what's called a bone marrow transplant. And when that happens, there are cells, stem cells, that can be removed from a donor. Those stem cells are grown in culture or treated, and then they're given back to the patient who has this disease after they've been given a treatment to wipe out their own bone marrow. So we know that this is an incredibly important use of stem cell therapy, and in fact, it's completely changed the survival curves, particularly for young children who end up getting these kinds of diseases. There's increasing numbers of therapies that are derived from stem cells that are now being made available. You may have just heard that there's a new therapy for cancer called a CAR T cell, which again is a modification of a stem cell that's being used for cancer. Okay, so what does this have to do with pulmonary fibrosis? This is a cancer. That's something totally different than what we think pulmonary fibrosis is. Oh, excuse me, I want to talk just for a second before I go into that about what biotourism is. So many years ago, biotourism really started when, to be completely frank, wealthy people from other countries came to the United States because we had a better medical system than they did in their own native countries. But biotourism has really changed over time, and healthcare is very expensive in the United States, as you all are aware. And so what's actually increasingly happened is that now Americans go to non-US countries to have healthcare done. It's not paid for by their health insurance, but because the cost of healthcare is much lower, they get their treatments somewhere else, and that place is less expensive. Okay, so I hope that all of you are saying, well, it's not all about money, and it's not, and there's a really high degree of variability in the quality. So many of you may have read, going back now 10 or 15 years about stars or people who are the rich and famous going to some place to have their plastic surgery done and sit on the beach for a couple weeks while their bruises go away. Well, that's how this started, but now increasingly biotourism is being used as a way to do things like stem cell therapy. And I want to now transition into talking about why patients who have diseases like pulmonary fibrosis may benefit from stem cell therapy, and then talk about what is existing currently. Okay, so this is a really complicated diagram that Brett Lay put together. And the reason I wanted to show you this is that pulmonary fibrosis is not simple. If it were simple, we would not be standing here asking the questions that we're asking. It's incredibly complicated. It involves all sorts of different cells. It involves all sorts of different parts of the lung, the surface of the lung, the epithelium, the blood vessels, the support tissue of the lung. And so why is stem cell therapy useful? Well, stem cells turn into, at least under the appropriate conditions, the things they need to be. They turn into the cells that they need to be. So that's really an oversimplification, and I hope that Dr. Glassberg is going to slap me down on that one and say why it is that that's not exactly true. But in essence, that's what the concept of stem cell therapy is that you take a complicated situation, you put in a stem cell, and that stem cell has the capacity to do what needs to be done. So that's why we're all incredibly enthusiastic about the potential of stem cell therapy. Okay, so where are we today? So is stem cell therapy ready for prime time? So what I want to tell you about is the cautionary tale, because I think that this is something that is going to be so incredibly valuable in the future, but I don't want people to take the wrong turn at present. So this is actually a statement that was put out in 2012. That was about the time that my colleagues and I from Johns Hopkins had written to the FDA complaining about these direct-to-consumer marketing of stem cell therapy that was happening in the US without FDA approval. So and I will show you some of this marketing. So the FDA responded and it said it's concerned that the hope that people have for cures is not yet available and leaves them vulnerable to unscrupulous providers of stem cell treatment that are illegal and potentially harmful. That's the FDA, okay? I could not agree with that statement more. We know that this is a very powerful therapy, but this is not a therapy that is quite ready for use yet. The FDA cautions consumers to make sure that any stem cell treatment that they're considering has been approved by the FDA or is being studied under a clinical investigation. Another really important point. So this is actually direct from the FDA to consumers, to our patients, to our caregivers. If you're considering stem cell treatment in the United States, ask your physician if the necessary FDA approval has been obtained or if you will be part of an FDA-regulated clinical trial. This applies even if the stem cells are your own. Even if somebody says, I'm going to take a fat pad off of you, I'm going to spin it around, do some voodoo with it, give it back to you, it's going to fix you. Those are your cells, but those cells are being put back into you in a different condition than they were taken out of you. That needs to be controlled and regulated and studied by the FDA. They went on to then say, you are considering having stem cell treatment in another country, biotourism, learn all you can about the regulations covering the products in that country. Exercise caution. Okay, this is our Food and Drug Administration. So let me go on for just a second. Okay, I pulled this off this morning. This is what is called direct-to-consumer marketing. And what this is like at night when you're watching TV and all of a sudden there's an ad for this drug that will fix your hypertension, that drug that'll fix your prostate, whatever it is that they're trying to fix. So this is where a company goes directly to patients who are in need and says, I have something that will be beneficial to you. You go tell your doctor about this thing that I have to offer to you. So I was nice and I redacted anything which will tell you which site this is from. So hopefully we won't get sued about it afterwards. But what this is saying is at such and such, we're leaders in regenerative medicine providing stem cell therapy for lung disease. Through our commitment of offering patients a more effective way to address pulmonary conditions, we're improving lives. Okay, so this is unapproved therapy. You can tell when you're in research because research never involves having to pay money for having a treatment done. So if somebody says to you, oh, we're doing this as part of a research protocol, but you're gonna have to shell out $10,000 up front for this, that is not approved research. That doesn't happen. And so some of these companies that are doing the direct-to-consumer marketing are kind of hiding under the guise of being clinical trials. And that's why it's so important to arm yourself with the knowledge to be able to distinguish these things. Okay, so I told you that that first FDA statement was in 2012, and that's when we had written our letter to complain to the FDA. This just was in Time magazine about 2 months ago. And what it says is the FDA cracks down on stem cell clinics, but patients are still at risk. So clearly, despite the fact that 5 years have gone by and the FDA is aware of this, this is really hard to stamp out. And part of it is because the web is such an incredibly easy access strategy for companies like this to get to our patients. And I'm not quite sure, but I know that at least once a month, one of my patients comes in and asks me about these kind of programs. And what I say is, this is not where you want to go. This is not the thing that is likely to make you better. If you want to do this, then you go to clinicaltrials.gov, you look for a legitimate clinical trial. You talk to Dr. Glassberg, who's been running one of our clinical trials, because that's how we're going to take this from what we thought might be something wonderful to something that really is wonderful in the future. So I'll end with what I say is caveat emptor, the buyer beware. Stem cells are a critical part of wound healing, and there is absolutely every reason to think that stem cell therapy may be useful in IPF. And clinical trials are going on, which I would encourage you to look into. But it is really not ready for use yet. And if you read advertising and it sounds too good to be true, you know it's too good to be true. Please do not allow yourself to get sucked into these things. We want to give you hope, but we also want to do it with a measure of caution and a measure of reality. So please talk carefully with your providers about any of these things that you see advertised on the web, and be sure you're not setting yourself up into a situation where you may have either no benefit or some harm. And with that, I'm going to end. Thank you very much for your attention.